On the one hand, there is some good news when you look at the national trajectory of this virus right now. We've got the case count sort of leveling off, but I'm here in California where we've seen record after record. So how are you looking at the trajectory of this virus? And we should point out that Melody Hom is joining in on the conversation here for the hour as well. Dr. Seth?
Well, thank you very much. And what I'd like to do is you compared the California numbers to the American numbers. And what I think you should do is also look at the North Dakota numbers, because the North Dakota numbers are coming down as was expected with social distancing, mask mandates, some of the interventions that were done by curbing social exposure. The numbers have started to come down. In fact, in our hospital here in Fargo, we are noticing less and less hospitalizations. So as you see the numbers leveling off in the nation and in some states going up, eventually should level off and eventually come down with all the interventions that have been done.
Just a quick follow there, though. Of course, after the holiday season, we know several hundreds and thousands of people have still managed to find ways to get together with family and friends, whether that's via airplane or even with smaller gatherings. Do we anticipate an additional surge and numbers to get bad, say the first week of January as we enter the new year?
Probably. You're going to see an uptick in numbers. That should be an uptick in cases. We'll probably see in a couple of weeks what the real numbers will show.
Dr. Seth, following up on that point, when you look at a place like California, for example, where there have been really strong restrictions in place, it does feel like even with those restrictions in public spaces, we're still seeing increasingly families gathering, especially during the holiday. How do you enforce or how do you crack down on something like that? If the idea is to stay masked, shut down indoor dining, at least at restaurants here in California, it's outdoor dining as well, but people are still gathering indoors. How do you sort of level off the case counts here when it's not in a place that can really be enforced behind closed doors?
I mean, what you're dealing with is, as physicians, we deal with on a daily basis. We have cancer patients who still smoke cigarettes. We have diabetics who don't take their insulin. We have patients who make choices that we may not agree with. So it's very difficult to convince a group of people to do what you're saying without educating them. So I think the best thing to do is consistently getting out the right message, getting out the information, the right information, and constantly doing that. In the state of North Dakota, we had an education program, and I think that's one of the things that has been helpful, because more and more the public were seeing information out in the public that was not filtered through other channels. So it seems like when it gets to the person and the individual in repetition, it does help, but it's very difficult to tell somebody to do something and have them do it willingly. I hope that we can continually educate the people and take the right message.
Dr. Seth, just thinking about the vaccine rollout that we've seen, especially with frontline workers, with the elderly, there have been some bungled processes in place, right? I understand you're North Dakota, where perhaps may not have been as big of an issue, but even the New York hospital systems, it sort of was kind of a madhouse when you look at even the most sophisticated healthcare centers in terms of the hierarchy of who deserves it first and the lack of a mandate, especially given some of the unknowns surrounding the vaccine. How are you thinking about it as you advise patients, as you advise fellow colleagues about the efficacy here and perhaps any real long-term side effects and repercussions that people may be raising?
Well, so I think when we see some of the side effects of the medications, with vaccines, you may have some side effects. For example, for myself, I had pain in the arm. We've had some incidences of nausea and headaches. That actually was documented in the literature when the studies were published, whether it was for the Pfizer vaccine or for the Moderna vaccine. Those were very common side effects. So I would suggest that as providers, we consistently look at the information and are consistently telling the right information that do expect to have some mild symptoms, headaches, nausea, those are common. However, the efficacy is very positive. The literature shows very clearly that it's very efficacious, and we'll see as the numbers go down in the country that this thing works.
And Dr. Seth, the fear is, if we can bring the conversation back to what we heard from Dr. Fauci over the weekends, which is that if there is still another surge that's coming at a time when we're already seeing a surge nationwide, how hospitals that are already at capacity are going to be able to cope over the next several weeks or so. You're practicing in Sanford, of course, and I'm curious what you're seeing on the ground there in terms of the availability of PPE, availability of resources to be able to look after the patients that are coming through the door. What specifically are you witnessing?
What we are witnessing is, as I said, the numbers are in North Dakota are coming down. So therefore, the hospitalizations are coming down. But to be honest with you, throughout the surge, we were fortunate enough to have the foresight to be ready with the PPE. I'm not sure that we were ever at a situation where we were struggling with PPE. I can imagine that there's many places in the country that aren't as fortunate. What I would say is get the message out for each hospital, to get the message out to the local communities if they are running into that situation. Because what we noticed is as the situation was getting closer and closer to families, especially in the local community, as they were affecting family members, brothers and sisters, mothers, etc., patients started becoming realizing, and also the local community also realized, we need to take this a lot more seriously. And in a couple of weeks afterwards, that did come down. The rest of it, we had to wait for, I would probably suggest that the administration will keep working to procure all the face masks and the PPE that you can.